case study by Renew Education. Let's take a look at this one. This one I call second molar implant question mark. The reason why it's question mark is because I see a lot of dentists do second molar implants. I personally do not do them, or I try to avoid them, and I try to explain to the patient a little bit more about why I choose not to do them. And this is a good example of a choice that you can allow yourself some breathing room and see if you really want to do this, or evaluate it with the understanding that this may not be an implant site for you, which is extraction and graft. But quickly, let's look at the treatment assessment before we get into looking at the details of this case. And that is that things look pretty good. Your bone density is a green. Your facial bone here in this area is a light green. Yellow for the IE nerve. It's not in a bad position, but you are getting into a second molar position, so that already shrinks your possibilities up there. Attached gingiva is yellow. Ridge height is yellow. And I have down here as orange is the chew pattern and failing front teeth. So if you look at the teeth here, they're really kind of munched down. He has all restorations here, which are causing part of that problem. But what happened to these teeth that needed those crowns in the first place? So I always think about that. You don't just get crowns for nothing. So my assumption is he wore down or chunked those teeth down, probably along with these, but only felt that these were the cosmetic ones, and he wanted to fix that. You can see this kind of really taken down off the cusp tips here, or the cusp tips here. So they're really truncated. He's got an implant here, which is good. This is a very old Straumann. I don't know if that's restored correctly, but it seems to be working. We could take a look at that later too. This is in a first molar position though, so I would highly recommend that. He's coming in because he wants a quote and to take a look at the second molar position. So let's look at that, and we'll take a closer look on the CT here. This is right down the middle. You can see it's infected. He's got decay. I think he saw an endodontist and said it's hopeless. So, so let's take this tooth out, and what we could do is graft it and maintain the site to about there. Our IA nerve is right here, and you're going to go maybe at best 11.5 millimeters to that nerve. So let's look at an implant that we would put in there. Let's say it's a 5x10. You're going to get really close to the nerve with that at this best case scenario. So a lot of these, and in particular this one, if you're going into second molar position, this is really tricky because it does require you to be way back here in a weird angulization, trying to make it work for how this goes. And you're going to have problems having access back here. How long will this last? Well, gosh, that's a hard thing to say. It's a second molar position. You're probably going to have it out of occlusion a little bit. It's going to be very difficult to restore. The gum tissue is going to still stay very high. The gum tissue is probably going to come up right around like that, which means you have your abutment, but then you don't have a lot of room. You're going to have to really take that crown subgingivally here to make sure that you have enough girth on the abutment, or you do a screw retained crown, which is also going to be very difficult to get your tool in there and screw that down with the crown and everything on top. So this is a very difficult prosthetic to deal with. You got to hope that this patient could really open up well, and you can get in there with all the tools you need, and hopefully you are safeguarding yourself from dropping a tool down the patient's throat. So here's another idea. Let's change that implant out. Well, let's get rid of these measurements, but let's change the implant out, and let's make a wider one. I know that, like I said before, Bioconcept and Hyosin, and there's some other companies that go into 6s and 7s, but what if we changed it to maybe a 7 by 7 or 7 by 8. Let's look at that and see what that looks like. So now that looks and feels a little bit better. This is kind of in the standardization of what like Bicon is about. And if you look at the slice view here, that looks pretty good, and you're staying safely away from the nerve as much as you can, kind of basically at the bottom of the socket site. So if you grafted it, you're going to have soft bone in here. You're going to really chunk it away. Really don't really like the Bicon burrs so much. So these big planes, and they're not like twist drills, but they really chunk things away. It's really kind of rough. If you feel like you can get in there, you want to tackle this, this is definitely a skill to an advanced level of placement here. And you definitely want to bury it, and you want to make sure that everything is kosher and heals up there. So what I recommended for the patient is, instead of spending money on a tooth in a secondary chewing area, and I'm not worried about this migration. That's another thing that dentists use against patients, is to say, hey, this tooth is going to migrate down if you don't have something opposing it, blah, 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 blah. Well, so then what, if that's going to migrate down, then what good is it if you're going to be reducing the occlusion on the second molars when you first initially do this? So if that migrates down, then that's going to be in full occlusion somewhere, sometime. I don't think at this age, after a certain amount of age, I don't see these teeth just migrating because they want to, or because there's no opposing. So I don't see that problem. If you do, then I guess that's maybe uniquely you. Maybe you have one. Maybe you should keep track a little bit more about really what's really happening. So we decided to do a graft in this situation and let it heal up, let it go for 6 months. And I said, if you really feel like it's worth investing in a second molar implant for an area that's a secondary chewing area, and you're not chewing 80-20 with that gone, that you're maybe chewing 45% here and 55% here, that's fine. That's pretty much 50-50. We all have a favored side, so he might favor the left side a little bit. But anyway, this is a great starter case to kind of test that out, see if you have access. If you have access, I would go with a wider diameter implant and a little bit shorter of a length. If you are interested in Bicon implants, I'm sure they would just love you, because this is one of those cases that would actually be a really good fit for a Bicon here. And also other implant companies, like I said, Hyasin or Bioconcept or other implant companies that have 6s and 7s that are available will get you this result, and that's not a bad result. The bone is good. I think he'll heal very well. Your tissue attachment is going to be running a little bit high here, so you're really going to have to put that margin below the gum line, and that's where you're going to be interested in maybe a screw retained system. But once again, you have to remember, how are you going to get that screw in there? How are you going to get all the tools and everything else in there? So that is definitely a difficult one. Get an implant system that's not so touchy about the actual thing. So the original Neodents, forget it. Never use those here. The hex is a 0.9 millimeter hex. You're going to probably strip it at this point, trying to get that into that area. So get a regular 1.25 millimeter hex screw or something similar, or the star shape. That works out just fine too. So pretty straightforward single tooth replacement. Stage this as appropriate. Look at the front teeth. Look at the IA nerve, and try to help the decision for the patient as well, explaining, well, you're really loading the front teeth a lot, which means that they're really loading the back teeth as well, probably. I don't think this is all just from biting directly on the front. So this person is pretty tough on their teeth overall, and you've just got to be aware in a second molar position that that's going to take a lot of force. So that's it for this one. Make sure you watch us, subscribe to us on YouTube, and like us on Facebook, and follow us around. We will be doing more and more live streams as well, so if you have any questions or comments, put it in that area. If you want to join us for live streams, that'd be great. So that's that case, and some of the other videos we have.